Hello, everybody. This is Dr. B, Dr. Sri Banerjee, and today we're going over dermatologic conditions. We're going over some histological slides and sections to try to determine and differentiate between cervical cancer and additional slides and histological sections that there may be. And this is an excisional biopsy here. Coilocytes are here on the right. And then there's some fibrous tissue with blood vessels going on right here. Okay. So how does condyloma acuminata look? And what is this thing right here? It's called a dermascope. So you take a look, and these are the one on the picture on the right is a picture of condyloma acuminata. And so this is a picture of how it would look under Dermascope. But that's a small device and something that is the best friend of a dermatologist. So, okay. And this is kind of how you differentiate between something that is benign versus malignant. Obviously, if you're having irregular distribution on the right, that is more malignant. Left is benign. And then the palpation, it's actually harder. Whereas if it's symmetric, if it's benign, then it's not, it's soft. And of course, the colors are actually distinct between the two. The bases are different. And so, and then when you do an acetic acid stain, then this is how it looks. Okay, I need to figure out the time as well, and because when I have the slides up, I can't see the time.
12:21.
Okay, thanks. Can you give me a 5-minute warning then?
Sure.
Thanks. Okay. So this is more of the history of this individual. 39-year-old female. She was initially given cephalosporin. She had some vulvodynia. Vulvodynia, what does that mean? Well, vulvodynia means pain in the vulvar region. So dynia means pain. Good to know that one. That's one that you should probably know by now. Bartholin's adenitis. Adenitis, what is that?
Inflammation of a gland.
Very good. Except for the what is, but that's good.
Literally, I swear.
Raven said also inflammation of a gland. Good, Raven, as well. So this is on the scalp region.
Psoriasis?
Psoriasis, okay. Anybody else? It's good to have like a differential, what are some? Psoriasis was one guess. What else? I don't know, maybe seborrheic dermatitis, right? So this is what that is called, seborrheic dermatitis. So Brianna talking about what does that have something to do with the immune system? What actually causes? Okay, so are we right now talking about this condition, the dermatitis, or are you talking about another condition, Brianna? Are you talking about this? Oh, okay. Yeah, so there can be some autoimmune inflammatory marker or inflammatory condition, autoimmune taking place. It also might be just the normal yeast flora that overgrows. So this is something that you see in men. Is this something you're more interested in, Brianna? Or just curious?
Just curious.
Okay, that's fine. I was going to assign you for to then present on this, but it's always good to hear different voices for a lot of these. So I might be calling on some of you to see go for Thursday if you feel like it.
Dr. B, it's 12:25.
Okay, thanks for that 5 minutes. Okay.
You're welcome.
So seborrheic dermatitis, very important condition. You have erythema, greasy-looking scales, typically hairline, nasolabial fold. What's nasolabial? Anybody tell me nasolabial? Midline chest, dandruff is a precursor, more common in men. Nose, and that's a good guess, Ali. So naso means nose, labia means lips, so nasolabial fold. So kind of the junction between the nose and the lips. Okay. That's how you do these, that's how you do medical terminology. You just break these apart and put them back together. So treatment for dermatitis, and this is the last one I'm going to go over. Mild, can be suppressed, but not cured. Mild topical corticosteroids, useful for acute forms. 1 to 2% hydrocortisone, remember that. But once controlled, maintenance with something like, shampoos like selenium, sulfite. A lot of the Head and Shoulders has some of that. Ketoconazole, you don't want to be taking too much of that. Causes gynecomastia, among other things. So, yeah. But there's treatments for that.